All right, well, good afternoon, everyone, and thank you for attending today's webinar. My name is Lacey Hensley, and I'm the director of the Institute for Coordinated Community Response. And just a few housekeeping tips. We encourage you to use the Q&A box at the bottom of your screen today to ask questions throughout today's presentation. I'll be monitoring those for our speaker and we'll ask those as they come in. If you'd like to make any comments or interact with the speaker or fellow attendees, be sure to use the chat feature. And then if you have any technical difficulties, in that instance, you'll select all panelists option and I will try to assist you with that. All right, so just a little background before we begin about the Institute for Coordinated Community Response. We were created in 2018 as a program of the Conference on Crimes Against Women. ICCR is a training and technical assistance program whose mission is to work alongside rural communities to improve their collaborative systemic responses to domestic violence. ICCR hosts monthly webinar trainings geared towards the needs of rural practitioners. In all of our trainings, we work to center the unique needs and strengths of rural communities while providing practical skills and tools that can be immediately implemented. Thank you for being here today and for your dedication to improving your own community's domestic violence response. You can learn more about ICCR on our website, www.instituteccr.org, and I encourage you to sign up for our e-blast to stay in the loop and all the great trainings we provide throughout the year. All right, so on to today's presentation. I'd like to take a minute to introduce you to today's speaker. Rachel Teicher is the Director of the Intimate Partner Violence Intervention at the National Network for Safe Communities. She's responsible for managing direct technical assistance and support for the National Network's partner jurisdictions, implementing strategies to reduce intimate partner violence, as well as strategies to strengthen police community trust, particularly with survivors of intimate partner sexual violence, and strategies to reduce and prevent group and gun violence. Prior to joining the National Network, Ms. Teicher worked at as the Director of Strategic Coordination in the New York City Mayor's Office to end gender-based violence, as well as the Director of Economic Empowerment. She developed new initiatives in concert with various community partners and was responsible for managing the agency's 4 self-sufficiency programs, focusing on a wide range of survivor concerns. While at the mayor's office, Ms. Teicher was also part of the administrative team that oversaw the Brooklyn Family Justice Center. Ms. Teicher also served as the outreach director in the Office of External Affairs at the New York City Department of Social Services, where she developed and managed a new community outreach initiative launched in all 5 boroughs addressing issues of economic inequality, food insecurity, and emergency assistance. Ms. Teicher's previously worked with Steps to End Family Violence and Mount Sinai Hospital Sexual Assault and Violence Intervention Program. She holds a JD from Hofstra Law School, an MA in Humanities and Social Thought from New York University, and a BA in Sociology from Haverford College. I hope I said that correctly. So, all right, I'm going to stop sharing and let you share. Welcome.
Thank you so much, Lacey. Give me just one moment to get my screen up and going. Okay. All right. So thank you again, Lacey, and thank you everyone who's joined us today. I really appreciate you taking the time. I'm excited to have the opportunity to talk to you. I will say from the start that I love presenting usually in front of people because I love connecting with the people that I am talking with. It's a little bit harder to do online. So I will do the best I can to make this engaging and interactive. I will definitely leave some time for questions, but Lacey will be keeping an eye on the chat box and we will pause as we have questions to try to take those in real time. And first, I'm going to tell you just a little bit about the National Network for Safe Communities, or NNSC, as we call ourselves. We're an action research center based out of John Jay College of Criminal Justice in New York City. We design, take to scale, and assess evidence-based strategic approaches to violence reduction and prevention. We do this with frontline practitioners like yourselves, And we often think about this work as being inherently rooted in what we think of as a coalition of the willing, which is really your coordinated community response partners. It's law enforcement, social services, advocates, community members, everyone coming together and thinking about their role in addressing and reducing intimate partner violence. And our work generally is rooted in the principles of focused deterrence, which is a framework for thinking about violence prevention and violence reduction. And for those of you that are probably trying to listen and read along, there will be a copy of this made available at the end. Um, some of this I'll go through quickly because some of it you're going to already know, and some of it I'll take a lot more time with. But overall, I want you to be able to think about the material and kind of hold on to that for a little while. And I'll, of course, be available for questions after this and in the coming days and weeks. So I like to highlight these principles because it's important to think about how do we look at working with people? How do we think about supporting communities? And what drives us? And so for us, it is these general principles. All of our work has a lot of similarities. It is absolutely vital to think about how do you change the experience of the criminal justice system and of what crime prevention and crime reduction can look like. This feels particularly important when we're talking about something like intimate partner violence, which we'll get to in a couple more minutes. But for us, things like creating certainty, which seems like a really small thing, is vitally important when you're working with people who are at high risk of hurting someone or of being hurt themselves. People don't always understand what our systems do, right? What help is available and what to expect when a phone call is made, whether that's to the police, whether it's to return a call to a victim advocate, or whether it's reaching out for help. Right? So creating certainty, the idea that if something happens, something else follows, and knowing what that looks like is really important. Providing clear information about risk can take a lot of different forms. That includes, right, what we're often really used to doing with our victim survivors, which is letting them understand what all the options are and the pluses and the minuses to them. This is something that we also have to think about doing for those individuals that are causing harm. We want to think about how we can mobilize the voices of the community. Community is not a monolith, um, not going to assume in any city, right, that we can say with certainty that the community is a certain thing. In fact, community is made up of so many different people and voices, and understanding that there are credible messengers and people who know, right, and can speak to some of the lived experiences and needs and fears of a community, vitally important as well. We want crime prevention and reduction to be something that is community driven, right? Is full of community solutions and isn't something that is just done to communities. Offering support and outreach is really important in our work as well. We are, of course, in this field of practice, very accustomed to thinking about how do we help people where they're at? What does that look like? But overall, when we think about violence reduction work and violence prevention work, support and outreach is something that is a little bit newer. Um, and so thinking about that component and making sure that it exists in the work you're doing is something that we work really carefully with our partners on. We also believe in face to face communication. Now, face to face could be a little bit of a misnomer. I'm not necessarily going to show up in front of someone and be like, "Hi, I'm here to talk to you today about intimate partner violence." We're not asking the partners to necessarily do that either. What we're asking is that we break down some of the barriers and we reach people in a direct way and we talk to them, right? We talk to them about risk. We talk to them about help, right? We talk to them about what could happen, right? And we follow through depending on what the situation is. We also want to enhance legitimacy and procedural justice. This is going to come up a couple of times today. I can't overstate the importance of thinking about how do people trust me? How do people trust my partners? How do people trust these systems? Understanding that despite our best efforts, we have all sometimes been part of systems or agencies or organizations that have inadvertently caused harm, right? And what we want to do is work to rebuild trust, right? That is a hard thing, right? It is not something that we do in a day or even a week, but it's something that we want to make sure we keep thinking about because without that trust, right, we know that we are going to be less effective in every single role that we have in this field. This is a hard one too, following up and keeping your promises. This is going to come up a lot. I know this comes up for all of us day to day, right? And this looks different. We often can't promise something the way we would like to. We can't guarantee a response or an outcome, but we can say, if this is a number that you need to call and it's manned 24 hours a day, someone will answer it. And if that's true, right, then we have to make sure that someone is answering that phone 24 hours a day, right? So it's thinking about when we say that we're going to do something, can we do it? If so, how, right? And if we don't, what does that do? Well, that's not going to help with our legitimacy. It's not going to help with creating certainty, right? And it's going to make it harder for people to understand and trust some of our systemic responses. And then last but not least is assessing and evaluating. I'll talk a little bit at the end today about some of what we've learned of how IPVI has had impacts in some jurisdictions. But in general, it is always important to sit down, not just with your leadership, not just with your stakeholders, right? But to those that are being impacted, the voices of our survivors, right? The voices of individuals who are causing harm, right? And thinking about what's working, what isn't, what do we know, and how do we do things moving forward? And as I mentioned just a moment ago, legitimacy is a really core component to how we and how I think about violence reduction and prevention, whether we're talking about intimate partner violence, whether we're talking about open air drug markets, whether we're talking about group violence or gun violence. It is important to understand that low levels of legitimacy, if we do not trust those that are tasked with keeping us safe and offering us help and support, we we have higher levels of violence. Right? And we also know that if we focus on increasing trust and rebuilding and repairing some of the harm that has done, right, we have a much better chance of having successful community violence practices. So, just a little bit more about what we know about the effectiveness of focused deterrence. Now, I will admit that when I came to the National Network for Safe Communities, I wasn't familiar with this because it wasn't on my radar at all. I was a direct service practitioner, then I was a program administrator, and a lot of my work had to do with the day to day and not thinking about the bigger picture of everything we know about crime, right? And violence prevention. And so, what I've come to learn through doing a lot of this work is how taking a lens of focused deterrence and applying it to serious public safety issues can be significantly effective and have a huge impact in communities across the country and across the world. And what I want to emphasize is it's not really a model or a program, it's a process, it's a way of thinking. So much of this might sound really familiar to you because so many of you are doing coordinated interagency work where you have to come together, right? You are that coalition of the willing. You are focusing on an important, intractable problem, and you are looking at ways to address it. When you do that, you create new facts on the ground. It's absolutely true. And from those new facts, you learn and you decide, okay, what's working, what's not? How do we keep going? How do we keep having a positive impact? How do we make sure we're not harming? Right? So it is a process, it's a way of thinking. Sometimes I think about it as a lens that you kind of put on. But I think many of you today understand inherently that when we're thinking about addressing a really serious, complicated issue, there aren't often just one off solutions that are going to work. And what we have to do is think about it, sometimes pulling different little pieces together, right, to come up with what we think of as a solution. So, we all here know a lot about intimate partner violence, and that's why I'm not going to spend a lot of time on this. Not because it isn't important, but because I am preaching to the choir. Right? We know that intimate partner violence is ubiquitous, right? We know that it is present in our lives, in our work, in our communities. We know that it is a driver of femicide, right? We know all of this. We also know that we don't always know the full scope of intimate partner violence that is occurring in any given city. Right? Part of the challenge as practitioners is knowing that we can't always count what it is that we know is happening. We'll talk a tiny little bit about data. I'm going to try to stay off my data soapbox. But the fact is, intimate partner violence is a cross cutting crime. It has to do with the relationship between the perpetrator and the victim, right? And so anything can be intimate partner violence. And yet, so much of what we're able to officially capture in our databases, in our reports, in our systems is centered around a set idea that IPV looks a certain way or only shows up as certain things. And so as chilling as these numbers are, many of us know from our real life experience that this is probably only a portion of what is actually happening in our communities. Similarly, with patterns of IPV offending, there are things that we know, right? There are things that are always kind of present, right? And then there are things that sometimes come out of the blue and we cannot predict, right? If we were all able to predict things and prevent them in advance, I mean, no offense, I think some of you, myself included, would not be here right now. We would have, I don't know, won the lotto, right? And we'd be donating our time and our money maybe to something like this or something else, right? But we're not trying to predict, we're just trying to understand. What we know is violence is a learned behavior, right? So if you learn about violence in your home, if you witness it or experience it growing up, right? That is something that becomes a cycle, right? We can break these cycles, absolutely, but we know that they can be deeply impactful in the lives of those of the people that we're working with, right? We know that there are cycles of power and control, right? We know that there is often an escalation in behavior before lethal violence. But we also know that when we think about intimate partner violence, there are things that we just know as practitioners to be true, that a pattern might be that someone is a so-called frequent flyer. Maybe what they're doing is, at a low level, right? But they are constantly coming up as someone who is causing harm, right? We know that sometimes there is no warning, right? There is no cycle. Someone just goes from zero to explosive incident, right? And so, as much as we understand about intimate partner violence and violence generally, right, we also know that when it comes to the violence and abuse that can occur between current or former intimate partners, that sometimes it can be surprising and unexpected. And to me, it's really important to think about the impacts and the harms of intimate partner violence. We know, right, that of course there are interpersonal harms. We know that this is deeply traumatizing to anyone who experiences IPV, right? We understand that, of course. We often aren't thinking about how those harms look in other settings. So it's not just myself, not just my friends or family, but communities, right? Entire communities or segments of communities can have experiences with how intimate partner violence has impacted them. Again, not just as an individual, right? But as someone who is part of a larger collective. So, one example can be something like a policy around protection orders and whether or not those are easily accessible for officers so they can look up when they respond to a scene to see if someone has an order if they don't have it on them. Right now, that can seem like a small thing, but we all know not everyone's going to have their order on them at any given moment. And not every officer is going to have the time to be able to call in and check if they don't have access to a database or some other system that they could look something up. So when you think about it over time, right, the inability to access a PFA or an OP can have a deep impact on communities of people. There are also institutional harms, right? There are the ways in which our institutions and our systems, right, impact ourselves and one another. Within institutions, we know that intimate partner violence is often one of the most challenging crimes and cases to have to deal with. Um, we know that without the trust of victim survivors and witnesses and community members, we may not get the information that we need in our roles as prosecutors, as investigators, right? As law enforcement officials, as a probation officer, we may not get the information we need to be able to do our job, right? And to do what we really are trying to do, which is to stop the violence and help someone stay safe, right? We know that there are other harms as well, including institutional harms that lead others to thinking things like maybe I'm able to handle the violence I'm experiencing at home because I know what that is and I'm afraid of what happens if I call the police, or I really don't want this person to lose their job, and so I'm going to weigh the risks here, and I'm going to say, well, I'm concerned that that response is just going to hurt that person and not help them, right? So it's always really important, especially when you're working with a CCR and interagency partners, to think about how We all experience the crime and the violence around intimate partner violence in different ways as practitioners too, and we have to be aware of how some of those things have those very personal and long-term impacts. So this is where I start to kind of drive us towards what we're here to talk about today, which is the intimate partner violence intervention. So there were a number of things going on that led to the creation of this kind of strategy. Some of it comes from just the experience of practitioners doing this work. Um, I don't know how many of you have to fill out grant reports and are asked to count things and to have deliverables when what you really want to do is tell the story, right? Because that's often not the thing that's captured or measured, but you know that there's been an impact. Well, kind of the negative side of that is this experiential effect, which is what we learn, right, from how our systems act. So for many of us, we know what happens when a report is made, when a case is charged, right? What that process might look like. And we often know, right, that these are going to be hard cases. The other side of that is the experience of those who are causing harm or are victim survivors who might learn a lesson inadvertently, right? That our systems aren't able to stop someone, right? That someone might get away with it. Um, and so they're not concerned if they're arrested, they're not concerned if they're charged. They feel very comfortable intimidating someone, trying to convince them that they should not testify, they should drop the case, they shouldn't report, right? Because the understanding we've often come to have is our system's responses can be flawed, and there are ways for us to feel like we can exploit that. And so we have learned, right? Oh, I'm going to walk, so I don't have to take this too seriously. We know that our legal response is often one size fits all, right? And that's us doing innovative, creative, you know, positive, progressive work, right? Because we only have so many resources. We only have so much time. We are often all doing the best we can, but we can't put all of our attention and support everywhere simultaneously, right? And that sometimes we're going to push for something and it might turn out to not be the best thing. And another really big factor that came into consideration when IPVI was being created and piloted was the fact that research was starting to tell us a different story about what we understand about persons who cause harm, about abusive partners. When I was like a little advocate, a young Rachel working with clients and going to court, right? I was taught that there are really just specialists, right? That for the most part, someone hurts their partner, they're not committing other crimes, right? They are someone who commits acts of domestic violence. Right? But what research has shown over the years is that's actually not as true as we thought. And that many abusive partners who are committing serious or near lethal violence, right, and many individuals that are repeatedly committing these acts aren't that different from what they talk about in criminology, right, or in other kind of community violence work as someone who is committing other violent crimes. We talk about it in the more academic spaces as being a specialist versus a generalist, someone who might be committing other crimes, might have other legal exposures. And this becomes an important part when we think about how do we best tap into some of the tools we have in our system's responses. And last but not least, we want to shift the undue burden that victim survivors experience. Many of us here today are familiar, particularly in the field of sexual assault work, the idea that our bodies are evidence, that we are the evidence. Victim survivors have a huge burden on them when it comes to uh, an effective, right, and what we might think of as successful systems response. And that often means that those of us that are investigating these cases, that are charging these cases, that are prosecuting them, that are supervising individuals related to intimate partner violence, right? That we have to rely on that victim survivor to be that driving force because they are often the evidence. And that is a real burden. We want to think about how can we lessen that. So, to tell you a little bit about how IPVI came to be, I'm going to take you way back, way, way back, um, and tell you a brief story about some really incredible partners in High Point, North Carolina. So, some partners in High Point, North Carolina, at the High Point, North Carolina Police Department, had been working with my boss and the leader of the NNSC, David Kennedy, on looking at various community safety issues and violence and trying to drive those numbers down. And they worked together to adapt focused deterrence, to look at individual chronic offenders. They looked at open air drug markets. They looked at group and gang violence. And every time they focused in, they were able to reduce the numbers of violent crimes, reduce the numbers of homicides, reduce the number of overdoses, but the number that kept staying high time after time were the domestics, right? The domestic call for services and the homicides. And so they got together and asked themselves, is there something different that we could be doing? Could we take a similar approach that we are taking to these other public safety issues and think about intimate partner violence that way? And the answer was yes. Now, when I talk about kind of what the strategy looks like, I'm going to give a lot of caveats because it's never going to be exactly the same everywhere. But generally, what we want is an approach that's rooted in these ideas that you want to do no additional harm, right? That you want to think about intervention, prevention, and deterrence, right? That you want to shift that burden from victim survivors and put it on the criminal justice system actors, those of us whose jobs it is, right, to work on these issues every day. And for those of us to say, like, we are taking this on. This isn't on you, right? And we want to be able, if we can, to address as many individuals who are causing harm as possible, right? That can be a lot. And we want the best support services we can for our victim survivors and our abusive partners. And we want to make sure that voices of the community are incorporated into this in a number of different ways. Here's the part that won't shock anybody is this works probably the way all of you are working right now in your communities. It's coming together. It means setting aside some of our frustrations and our differences, not ignoring them, finding ways to address them and air them out, right? And creating a space where we all understand our roles and we take ownership of what we can do, right? And that we are committed to something, knowing that sometimes we're not going to get it right. We used to work with a really wonderful partner at the Battered Women's Justice Project who used to call what we did CCR on steroids, because there is a level of intensity that your core working group or task force or team um, brings to all of this. And it's important to note that it can't just be one of these entities. Certainly, from the perspective of our systems, if we could arrest our way out of intimate partner violence, we would have done that already. If we could prosecute our way out of it, right, or incarcerate our way out of it, we would have done that. And we know that those things are not often going to be the sole or the best solution. So it's thinking about bringing together everyone who's a part of this and coming up with what your specific community needs. So, speaking of certainty and needs, it's thinking about what is the intimate partner violence that is occurring? What's the dynamic in your community? And when we think, as we talked about a few minutes ago, about the whole range of intimate partner violence that might be occurring, we know that this can range from a very low level non crime, right, to something that is lethal or near lethal, right? Someone who is perpetrating multiple acts of intimate partner violence repeatedly, potentially in a short time frame, and then everything in between. And we often think about our response as, well, the more serious it is, the more intense it's going to be, because that's how we have to divide our resources. We know that from our training and our experience, that sometimes that first offense that that we learn about is actually very, very dangerous. We often will see at the lowest level, even though there isn't a crime that occurred that we can charge, that we do not feel good about what happened, right? And at the same time, we also know we may not be able to give the same support and attention to every single case that crosses our desk, and every victim survivor, you know, should have a tailored plan as well. And so balancing, what does it mean to respond appropriately and proportionally? And how do you do that when you are thinking about stopping the individual who is committing the violence? And so we know, if this is what is known to us as systems providers, right, that we can start and think about, can we address any one of these levels, right? Can we address all of them? And what we think about is potentially a way in which you address all intimate partner violence that comes to the attention of law enforcement. There are ways to do this as well in a community setting, in a non law enforcement partnership. Um, that looks a little bit different. But for our discussion today, it's primarily going to be about, how do our CCRs, how do our coordinated community interagency responses work together, sometimes in parallel, to respond to the IPV that is occurring, the needs of the individuals that are being hurt and who are causing harm. And again, how do we prevent, intervene, and deter? And what that looks like is a gradient, right? It is a graduated response from law enforcement, right? A increased response from victim advocates. And this is done in parallel, right? With you as a task force or a working group or a team, right? Deciding from the outset, as we unpack and analyze the data around intimate partner violence in your community, what do we understand about it, and how are we going to address it? we think about what does different levels of IPV offending look like? What does that mean? And what is the appropriate response going to be at every single level? It is unquestionable that this has to be centered on survivors. Part of the originating thoughts for this was, like I mentioned earlier, thinking about and bringing to the table the voices of victim survivors and advocates who were feeling as though, you know, something just wasn't working with the traditional response that they were experiencing or that they were a part of. So, focusing on the needs of victim survivors can often look like layering on to some of the things that you might already be doing, right? It could be building in more partnerships. It could be that you are getting everything absolutely 100% right. And, you know, kudos to you. And please tell me your secrets. Um, but are always open to thinking about, okay, are we missing something? Should we be thinking about something else? Do we have the right representation to understand the needs of those that we are working with? And this also takes the form of things like reliable information. This goes back to trust and legitimacy. This goes back to creating certainty, right? And this also goes back to that follow through, right? We want survivors to understand what their options are. We want them to understand the system and their responses, right? We want them to hear from the people that have the right information what's happening and to not be getting information that is often unreliable, right, from other individuals that could influence, sometimes in the wrong ways, the decisions that they may make. So we want to make sure that they understand, right, and that they feel safe engaging with us. Right? We want there to be a focus on the person who is causing harm. This does not take away from working with survivors. This enhances that work because for many of us, we have had the experience of working with a victim survivor, helping them make the choices, right, that they need to, that they have chosen themselves, right, to be safe, right? That might look like ending a relationship, it might not, right? It might look like going to shelter, it might not. But no matter what help and support and empowerment we are providing to victim survivors, if we are not focusing on the individual who is causing harm, if we are not focusing on the abusive partner, what we all know is that they are likely to find someone else, right? So if we do not focus on the individual who is causing the harm, if we don't work to offer them help, right, and try to prevent and deter them from committing another act of intimate partner violence, right, we are leaving that problem a little bit unaddressed. So, what would it mean to engage with abusive partners? Well, it's that direct or face to face communication. It involves setting the expectations, right? That includes explaining sometimes that intimate partner violence is violence, it is a crime. Um, there are things that often many of us are like, I'm surprised to learn that is even in the penal code, right? Well, there are things that are also so normalized, right? For any of us who spend any amount of time online, we know through TikTok, through Instagram, there are so many ways that abuse and intimidation and coercive control and harassment show up, right? And so when we think about all of the ways that we experience the normalization of intimate partner violence, we have to ask ourselves, what is the expectation that people have about what a healthy or a safe relationship is? So you need to reset that expectation, right? And help people understand first and foremost, right? Even though this might seem okay, even though this might be something that is learned, even though this is something you might see, right? But it's actually not okay. Right? And we want to reset what the experience is of engaging with the system. We want to talk to someone who is causing harm, and we want to offer them help. This is an unconditional offer of help. Sometimes it is a forced offer of help, right? It could be a condition of a plea. It could be part of pretrial supervision. It could be because someone is on parole. It could be, right, because friends and family have staged an intervention. We want help to be made available. There is no obligation for an individual to accept that help unless there is a court order or some other mandate. But from the perspective of thinking about how do we directly engage with a person who's causing harm, we have to start from a place of an unconditional offer of help. We also, though, have to match that with information about and consequences for continued violence, right? And when I say violence, that could include and should include a nonviolent violation of a protective order, right? All of the ways in which we know that an abusive partner might continue to engage with their current or former partner, um, and they are potentially legally not supposed to be doing so. Right? So we want them to understand that there will be consequences if consequences are available, right? And that we will focus on trying to stop you from causing harm, right? We will help you if you let us, and we will stop you if you make us. It's really important through all this to incorporate the voices of our community, right? Because these, again, these are the credible messengers and the change makers who understand and can speak for the experience and the needs of individuals in our community. They might feel more comfortable speaking up. We also know, right, that these are the people with influence, right? These are the people that our clients, right, might be going to ask for help, to talk to about a problem. And we want them involved in resetting the narrative around intimate partner violence, right? That the community also has a role in saying, you know what, I, I'm not okay when you talk to your partner like that. I'm not okay when you use violence like that, right? And that's a hard thing, right? We know part of some of the challenges with IPV is that it does not happen always, right, in plain sight. This is often private. It often feels private. It is often something that people don't see or know about. And when they do, they're not sure if they should or could do anything, right? So, changing the way in which we experience this, right? Changing the way we are bystanders. I'm sure some of you have heard about the term upstander, which is a way of being an active bystander, right? You're not just sitting back and watching and letting it happen. You are standing up and saying, I hear something, I see something, how can I help? This isn't okay. Right? And as we talked about at the beginning, finally, that follow up and follow through, it's absolutely important because we can do all of this. But if we don't circle back and close the loop on what we said we were going to do, right? We're not keeping that promise, right? We're not holding up our end of being consistent, right? And being able to say that we're doing something and we're going to follow it through, as impossible as that often can feel, right? We have to think about, What does follow through mean, right? How do we ensure that we are circling back when we say, right? We will stop you if you make us. What does that even mean? Right? So we don't ever want to make a promise that that we can't actually keep. But we do want to be clear that if we are committing to something, we're going to do the best that we can to follow it through. Well, many of you are already thinking about or providing support and outreach to abusive partners. And what I think can be so interesting is to see the way the advocacy field has learned so much um, from how we do this work that it has spread to other disciplines and other types of violence prevention. So much of what we think about as kind of standard practices um, are things that are being picked up in other areas of practice and now really thoughtfully and thankfully being applied to high risk individuals in different settings, right? Individuals who are at risk of being shot or at risk of picking up a gun and shooting someone themselves, right? That we need to have a support model, right, that recognizes trauma, right, that provides this unconditional, genuine offer of help, right, that looks at the big, small stuff. Um, Victim service providers and counselors and advocates for years are so used to that big, small stuff. Um, do you have bus fare or train fare to get home? Do you have a ride? Do you have childcare? Um, do you have enough SNAP for the month? Do you need access, to reliable, healthy food this week? Right? This big, small stuff, those crucial real-time needs, right? Those exist for the abusive partners too, and we have to think about that and offering them kind of the whole the whole universe of possible help and support that we have beyond just thinking about some of those very traditional options that we have, some of which we might be really happy with. We might feel really good about the batterer intervention or abusive partner programming that is happening in our community. We might not feel great that everyone gets anger management and we're not sure if it's teaching them something, right? We're often thinking about very specific types of help, including mental health and substance abuse treatment for our abusive partners. But we urge our partners to think bigger and broader and smaller, really, about those real time needs that can come up. Right? And so this is where we get to the part where um, we talk about the power of the criminal justice system. So I have heard this before. I think about it this way a lot of times. You all might think about it this way or a different way, but criminal justice, crime prevention, this is strong medicine, really strong medicine. And the dosage, right, and the treatment can't always be the same for everyone. It doesn't look the same. We know that too much medicine can make you sick, right? And sometimes just a little bit might be all you need. The idea here is to reduce harm to communities and individuals. And so, what that means is thinking about how enforcement and sanctions fit in, right? When we are working to intervene and prevent and deter more intimate partner violence, right? So, we will help you if you let us, but we will stop you if you make us. This is the part where we have to think about the stopping you if you make us. And what we know is that, right, if someone is committing other crimes, right, if they are in violation of civil codes, right, or civil orders, Or if there are other ways for the community to quote unquote hold someone accountable or stop someone, we have to think really creatively about sanctions, right? So we call it pulling levers because in the criminal justice sphere, what we would do is look at whether or not someone has these other legal exposures. This is not where we start, right? But if someone is continuing to commit violence, if someone is continuing to abuse their current or former partner, if they are committing acts that are at a certain level, right? So we think, remember, going back to this kind of gradient, this scale, and our community of practice coming up for our city or our county, what it means to be committing an act at any of these levels, we can then say to ourselves, well, if this person isn't stopping, what do we know and what do we look at to stop them? And this is not about uh, punishment or excessive enforcement. We want us to think about the criminal justice tools we have as scalpels and not hammers. But it does mean when someone is not choosing to stop, that those of us that are in these CCRs and are holding roles in our communities, like police and prosecutors and probation officers, that we have to take it upon ourselves to use the tools and the avenues that we have to pause or stop someone's continued offending, right? Sometimes what that looks like is changing conditions of supervision. Sometimes it looks like other criminal legal exposures. Perhaps there are other open cases, right? Perhaps this person is known to be engaged in some other type of criminal activity, right? And there can be coordination around focusing in on charges for that specific case, but communicating, right, that we're not going to offer a plea this time because of the intimate partner violence, right? It's thinking about those different ways that you can pause someone. We think of them sometimes as speed bumps. Sometimes it's just going to slow someone down, right? But how do we help someone stop if they are not choosing to stop themselves? And again, this piece is really important because you can have the strongest partnerships and the strongest CCR in the world, right? But if you are operating in a community that does not trust you, that fears you, right, then it is going to be hard. It's going to be hard for people to accept when you offer help, right, that they can actually get it. They may not want to come to you and report a case. They may not want to testify. They may not want to write an affidavit. And so we need friends and family and influential, incredible messengers to stand up and say, right, we support this. Sometimes it looks like something as simple as, I don't always see eye to eye with the police, but I agree that intimate partner violence is wrong, right? And if you're not going to stop, someone needs to help you stop, right? Or it could be, I believe survivors, right? And thank you for coming and talking to me. And let's go find someone that I know that I trust that can maybe talk to you in depth about the help you might need, right? So we know that these are the voices of people that we will go that extra mile for. And in return, right, we are willing to listen to them. It's again so important to think about how are we representing this? What does this look like? And before anything can go into operations, victim safety must be prioritized. And there has to be that kind of fail safe that if we're concerned about risks to a victim survivor, right, that we that we pause, right? So we're going to talk a little bit about how we do direct messaging there are lots of situations that come up, right, where advocates, law enforcement officers, right, people will say, you know what, I don't think that's a good idea. I don't think that's safe. My gut is telling me, my experience is telling me, right? You all have to be able to trust one another to say, okay, right? So then we're not going to do it this way. We'll have to figure out something else. So if we were to think about this as that full spectrum of the lowest level, a call for service is made and there's no crime that occurred, right? To the most serious incident that you can possibly think of that is near lethal, right? Anything that law enforcement knows about, that there is a parallel piece of notification, right? That direct communication to the abusive partner and separately to the victim survivor. And this is a very general, basic idea. Right? There is always affirmative outreach for victim survivors or the attempt, right? This can look different in different places, right? We want there to be, of course, that whole menu of services, but we also know that at every level, as we assess that these risks might be higher, right, we might be a little bit more intensive with our follow up, the types of services we're offering, how we're framing things to victim survivors or to clients that are, that are working with us. We also want them to be fully aware of everything that is happening with this strategy. So we want someone to know whether or not we are going to go and talk to their abusive partner. We want them to have all of that reliable information from us, right? We want to interrupt that miscommunication and manipulation, right? That can occur, right? And we want the information to come from us. We want it to be as clear and straightforward as possible. And sometimes that means us taking a look at all of the different ways survivors are hearing from us, sometimes to the point where they can't keep straight who they're talking to, right? They've told their story so many times, and they're not really sure what it is that we're doing for them when they're on the phone with us or in our office, right? Similarly, we want there to be communication to abusive partners at every level, right? So, at every possible contact that is had with law enforcement, there is an opportunity, right, to explain that intimate partner violence is violence, it's a crime, right? It's not okay in this community, it's against the law, right? That the burden is not on the victim to pursue this, right? If there are criminal charges, that is going to come from the city, the county, the state, right? Federal government, uh, right? That help is available, right? And if someone continues to offend, if you have someone who is repeatedly offending, or you have someone who presents as committing more serious intimate partner violence, that message is enhanced. It is more intense. It can include information about their legal risks and some of the possible things they might want to avoid if they by stopping their violence, right? To the point where if someone is continuing to commit intimate partner violence, they have been messaged that if they don't stop, there will be a focus on them to stop them. You- And that's right at that highest level when we think about our very high risk, high lethality cases, right? That is where we're thinking about things like pulling levers and thinking about what does sanction and enforcement really look like beyond what might be traditionally available to us. Now, the messaging piece of all of this is really, really important because I'm just going to assume that most of us here today are really good at our jobs. right? That we are very practiced in having conversations with people, both victim survivors and individuals that cause harm, but we may not have ever laid it out for an abusive partner exactly this way, right? Which is letting them know, right? I'm going to repeat some of those same things again. This core message, right? It's violence and it's wrong, really simplifying it here. It's violence and it's wrong, right? There is help for you if you want it, and help could look like all of these different things, right? But that if you continue to commit acts of intimate partner violence, we will have to continue to focus on you, right? And again, sometimes we have to get very specific, right? Because there are legal consequences for what that individual is doing. Communication can take a couple of different formats. Um, it can be, as many of us are doing right now already, informal. But we think sometimes that formal communications are actually a way to help people better understand and process the information. And what we know from research is that this type of messaging actually can carry. Um, we've all, I think, played that game telephone where we're passing a message along, and at the end, it sounds really different than it did at the beginning. So we don't want telephone, right? We want that message to be understood exactly the same way, the right way from start to finish. So it's really more like how do we improve on that game of telephone? How do we communicate something that is actually going to get passed along? And so what we know is a notification, right? That involves both a verbal communication, but also gives someone something tangible that they can look at, that they could bring to someone to think about with them, right? Gives them something else to hold on to, right? So for us, when we're talking about IPVI, a notification would be a way of communicating to someone that they have come to law enforcement's attention because of an incident. Um, and again, this could have been a non crime, right? Or an arrest might have been made. Or this is a multiple arrest for this individual, right? But that something occurred, right? Because of that, the partners are involved, right? It is resetting those expectations, it's explaining that core messaging, right? And it's delivering that message, right? So that looks like oftentimes a letter and some verbal messaging. How this gets done looks different in different places, and we'll talk a little bit about that. But it's important to think that we want someone to be able to really sit and reflect when they are ready, right, to what this communication is. Right? And so we want it to be accessible, right, both in terms of its learning level and its language, right? We want it to be in plain language so someone understands. We don't want it to be something that is full of exaggerated promises that we know we cannot commit to, right? We will arrest you if you do this again. We may not be able to do that, right? That just might not be a thing that's possible. But we will continue to focus on you if you continue to commit intimate partner violence. That's a different kind of promise that we can say, you know what, we can keep focusing on this person. As someone is committing more serious or repeat intimate partner violence, we think about how we customize this notification, right? So this is where we start to think about communicating to someone about their specific legal risks, right? This is where it can be very powerful to have other credible messengers be part of this notification, right? And you know, in a way, it is that last effort to say, right, if you want help, it is available, but we will stop you if you make us, right? And we're going to tell you all of these things that maybe you don't realize we know about the ways in which you might be stopped if you don't make that choice yourself, right? And so that again looks different in different jurisdictions. It looks different here in the US than it does abroad. Um, and this all gets tailored to what your community is comfortable with and what your CCR wants to represent. There is one other form of formal communication, and that's something we call a call in. Um, for those of you that might be familiar with something called GVI, the Group Violence Intervention, or focused deterrence approaches to gun violence, call ins are these in person meetings with a select number of individuals who are high risk for committing violence, getting a kind of a CCR interagency message about stopping their violence, right? It includes law enforcement, it includes social services, it includes community, right? It is um, well rehearsed, it is private, it is an intensive thing to set up and put on, but it is very, very powerful as well. Some places do this for intimate partner violence, some places do not. We offer a lot of intensive support specifically around this because it does have risks with it, right? And so just kind of naming that oftentimes people get very excited about the idea of a call in, but they don't think about all of the logistics, the messaging, and the impact that it can have, and then the follow up that happens afterwards that is absolutely essential. All of these different forms of communication have different needs. They work similarly, but they can be easier or harder, smaller or bigger. So they can have different impacts, but all of them have the same goals, right? And the idea is the same, right? Reset those expectations, be able to intervene as swiftly, in as timely a fashion as possible, right? Get people the right information, right? Again, not just our victim survivors, but individuals who are causing harm, right? And reinforce the message of why we want someone to stop, right? And throughout all of this, we are working to strengthen law enforcement's legitimacy within the community, right? By being consistent, right? By being procedurally just, right? And by being those strong collaborators that we know our law enforcement partners are and have been. Sometimes that's not always seen by everyone, right? And so this is an opportunity to say, right, we see you, we hear you, we want to help you, we want you safe, alive, and out of prison, right? But if you are not going to stop your violence, we are going to have to focus on stopping you. And overall, you tie this message together, right? So when this is in the form of some talking points and a letter, right? We work a lot as a TTA provider with jurisdictions and how do you make this message bite-sized? How do you make it so officers don't have to pull out a script? How do you make it so your prosecutors don't have to spend another half hour on the record reading something, right? What is the core message that your team is trying to get across, right? How are we conveying it? Are we meeting all of those core elements, right? And again, for something like a call-in where we are actually bringing groups of people together into a space to talk about intimate partner violence and the risks of repeat offending and the legal consequences, right? We want that message to be really balanced, right? Because we want to talk not just about the law enforcement obligation around public safety, right? And how intimate partner violence will be treated like other crimes, including looking at other legal options, right? And making specific decisions about those cases because they will not stop their intimate partner violence, right? You want to balance that with the community messages, right? Messages that talk about a path towards behavior change, a path towards a better a better opportunity for having a safe relationship with their partner, right? And offering them hope and support to help them achieve some of the things that they might need in order to stop engaging in intimate partner violence. Customized notifications, as I talked about, right, are going to be very specific. Um, and so we want to be certain that people understand why they're being talked to. It's not an interrogation, right? It is not an interview. It is not for fact finding. It is not even really a dialogue. It is a one-way message. And you want this to be done as a team. It is not just about law enforcement, right? It is also about our community of practice, right? It is also about our community. So we think about what does it mean to deliver messages um, together. And just to spend another quick moment on the community piece, right? And the moral responsibility that we have to one another, right? Is that we want people to make the best possible choices for themselves. They may not always be choices that we agree with, right? But everyone should have the opportunity to be treated with respect, to have the information they need to make decisions, right? And to get that support, right? These are some really basic things that I think almost everyone will say that they believe in. And we have to think about how when we are not focusing on the person who is causing harm, right, we are creating an opportunity for them to find another victim and another and another. We know that there are lots of challenges to doing this kind of work, right? I'll let you all read this one because I'm sure you've got questions about challenges for me. Oh my goodness, I'm going so slow. I'm so sorry. I'm going to speed it up a little bit. The victim survivor messaging is something that I think is going to be pretty intuitive to all of you because we know that it's vital to have robust victim survivor services and a discussion, right? And what we want to do is make sure that they are accessible. That can be really hard in our rural communities, but we want to think about how can we make it as easy as possible and as safe as possible for someone to get the help that they need and the help that we can offer them, right? As I said earlier, right, we want to center on survivors. And what that means is attempts at affirmative outreach, right, enhanced safety planning. Sometimes centering on a survivor might look like explaining an order of protection to their abusive partner, right? Many of us have worked with clients that don't want their relationship to end or don't want their current or former partner to get in trouble. They just want the violence to stop. One simple thing that we might think of is talking to an abusive partner about the order of protection against them, helping them safety plan for not violating that order, right? Explaining how it works. That also centers on survivors. It takes some of that burden off of her if she or he or they are being contacted by their partner, right? And it helps that person who is causing harm better understand what to do when they are in a situation where they want to do something that is legally prohibited, right? And in what is not going to come as a surprise to anyone, this message is all about, right? This is not your fault. This is not on you, right? We we will focus on this. We want you to have every opportunity to get help and support, and this is how you can do it, right? There are no obligations to take help. There is no mandate to engage in services. All of this combined, particularly this direct communication, right, and affirmative engagement, very proactive connections to individuals, is a way that not only interrupts intimate partner violence, but also grows trust. It grows trust between the partners, between survivors and the practitioners they work with, right? And it actually changes the experience of being involved in a systems response. Some of what we know about why and how this works comes from the broader community violence intervention work, where these types of messages and this strategic framework has been applied, right? What we've also seen from doing this in communities, focusing specifically on intimate partner violence, right, is that this actually does help shift what's happening on the ground. And just briefly, a little bit on the impact that we have seen here. First, starting with High Point, North Carolina, where they started thinking about this and working on it in earnest in 2009. And prior to that, they had had overall homicide spikes, but they had seen higher numbers of IPV related homicides. They started thinking and working on this direct engagement and having a gradient of how to engage in 2009. And by 2012, they were doing everything, the lowest level to the highest level. And what they saw was, I mean, really quite impactful. They saw IPV homicides drop for quite some time to zero. Over the years, they have had IPV homicides. We unfortunately can't prevent these as much as we are trying to. Oftentimes, these are individuals that are not known to law enforcement. They may not be known to any of us in our community, even. So, just noting that in 2015, 16, and 18 and 19. These were actually all homicides perpetrated by individuals that were not known to the task force that was focusing on IPV, right? And in 2020, which was a hard year for so many of us, it was the first time that someone who had been on their radar went on to commit an IPV homicide. They are continuing to do a version of this. It's called OFDVI, Offender Focused Domestic Violence Initiative, right? And they have consistently seen, right, low reoffending numbers. And they've consistently seen much lower numbers of IPV homicides than they did when they weren't thinking about it in this way. Right? There is an evaluation that came out, and briefly, it showed a decrease in repeat calls for service, a decrease in arrests, a decrease in injuries result from victim survivors. It also had evidence of satisfaction from victim survivors, despite the outcomes not always being what everyone wanted. They felt like they were getting more support and more attention, that they understood the systems better, and that they could trust that when they called for help, they knew what to expect. We also know that calls for service can go up and down. right? We know that these numbers can be spun as a good thing, as a bad thing. In reality, the community based social service providers were able to report that there was a huge uptick in requests for services and engagement from victim survivors. So while calls for service went down, particularly around individuals that were committing repeat acts, the victim advocacy organizations saw an increase in the number of people that were reaching out to them, right? Or agreeing to come in and talk to them and think about getting help. National recidivism rates could be a whole other presentation. We know it's a little bit like apples and oranges, um, but just wanting to note that from that initial evaluation, what High Point saw was overall a 19% reoffending rate, which is significantly and shockingly low in comparison to what most studies have been able to show about reoffending for intimate partner violence. Now, this is work that we've replicated. One of the cities that we've been fortunate to work with is a small, kind of semi rural jurisdiction in upstate New York, right, where we started working together in real earnest in 2017. We started implementing in 2018, and we have continued to see numbers reflect some really positive impacts of this effort. And in New York, we've got something called a DIR, it's Domestic Incident Report. And that's a specific kind of police report that has to be filled out whenever an officer is responding to a domestic. So you're able to look at these really specific types of reports, right, and see that there has been a decrease. What we've also seen is it has slowed down or stopped some of the reoffending, right? Which means more time and more safety for victim survivors. Right? And this won't surprise anyone. We know that the more significant the violence and abuse is that someone is perpetrating, right, the more likely it is that they are going to repeat, that they are going to do an act again, possibly again and again. And so they are often the hardest individuals um, to work with. These are often the individuals where you do have to focus on stopping them because they are not making that choice themselves. Right? And so, in conclusion, because I have talked to you all for so long, um, just summing up, right, that this is an approach that tries to break with some of the ways in which we have often thought about addressing intimate partner violence and violent crime in general, and thinking about how to increase the trust and legitimacy and the safety to everyone involved. We want to be able to talk to people. We want them to understand that help is available and that they're important in this community, but that the violence will not be tolerated. And that together there are actually opportunities for us to prevent and intervene, right? And often deter additional intimate partner violence from occurring. Right? So I'm just going to go right there. This is my contact information. You are, of course, all welcome to reach out. And I'm going to stop sharing right now. So if there are questions, we can take them. Sorry, y'all. I was so enjoying talking to you all. I started to lose track of time.
No, that's great. Thank you so much. So, if we can stay on for another minute or two, if anybody has any questions, if not, you do have Rachel's contact information. I'm sure she'd be happy to respond via email. And there's some great information on their website as well, which we'll share as far as the handouts are concerned. So I'm going to share my screen again really quickly. We have another webinar next month that I want to make sure and tell you about. It's going to be April 26th at 1:30. That's Central Standard Time. Registration is required. We're going to have the Sexual Violence Justice Institute speaking to us about rural sexual assault response teams. So you'll want to join us for that. And then finally, I want to remind everyone about our conference on crimes against women. We hope that you'll join us in Dallas, May 22nd through the 25th. You don't want to miss it. Early bird pricing actually ends tomorrow, so be sure and get registered today. For more information, you can scan the QR code there. A recording of today's presentation will be available on our website within the next 24 hours or so. And once I conclude the webinar today, you will receive a link to complete a survey, and that survey will populate in your browser and take a few moments to complete it, and that's how you're going to receive your certificate. So if y'all, let's see, I have a couple folks chatting in. Let's see, they're just saying thank you, Rachel, awesome presentation. So, all right.
Thank you all so much. I'm wishing everyone a good and easy rest of their day. And
Yes,
thank you so
thank you
much for
so
having
much.
me. All
You
right.
take care. Thanks.
All right.
Bye.
Bye.